We are broadcasting.
All right, thank you. All right, good evening, everyone. I will give folks just another minute to log on. Looks like people are slowly filtering in. All right, I'm going to go ahead and get started. Good evening, everyone. My name is Ricky Takayama Men, and I am the chapter president of the St. Louis chapter of NAHSE, so the National Association of Health Services Executives. I want to welcome everyone here this evening for our 8th annual Health Disparities Symposium. Next slide, please. So just want to give a brief overview of the National Association of Health Services Executives. So we were started in 1968, and we are a nonprofit association of healthcare executives. So our mission and vision are twofold. So one, promoting the advancement and development of minority healthcare leaders, as well as elevating the quality of healthcare services rendered to minority and underserved communities. I won't go too far into the work of NAHSE, just really want to provide a brief overview, especially want to save time for our panelists. Next slide, please. So a little bit about NAHSE St. Louis. So we were reinstated back in 2011, and of the 28 chapters across the country, St. Louis remains one of the largest, with 70 individual and 12 institutional members and organizational supporters. So as you can see here, we have Ascension, Barnes, BJC, CareSTL Health, Centene, et cetera. I won't go on and on, but we are very excited and proud to partner with all of these organizations. They are why we are here today hosting this Health Disparities Symposium. So want to give them thanks for being here and allowing us to do this with their support. Next slide, please. A little bit about NAHSE St. Louis leadership. So here you can see a slate of folks who span some of the organizations you saw on the previous screen. I am the current chapter president, as well as Michael Whittier, who you will hear from later today, who is our president-elect, and then a number of folks who are behind the scenes here today on our leadership team. Next slide, please. NAHSE St. Louis, so with all of our institutional members, we have representation on our senior advisory council from all of these organizations. We do have a few vacancies, but they are really the drivers and advisors of the work here in St. Louis and what we put forward for our members and institutions in terms of programming, in terms of networking opportunities, et cetera. Next slide, please. So today I want to welcome everyone again to the 8th Annual Health Disparities Symposium, the impact of COVID-19, Missourians' critical need for transformation. We have an excellent panel here today, and I'm really excited to kick things off. And so I do want to hand this over to Sean DeBria, who is the Director of Policy and Advocacy for the St. Louis Regional Health Commission. Sean has over 15 years experience as an organizer, advocate, strategic planner, and policy professional. And so I can't think of anyone better who can lead this conversation with a great panel here today. So I'm going to hand it over to Sean to kick things off. But before I do that, I do want to let everyone know that we do have a Q&A box down below. If you have any questions throughout the panel, please feel free to type your questions and we will try to get those answered throughout the presentation, if not towards the end. There is a chat box feature. I will be posting all of the bios of our speakers here today. Like I said, this is a short conversation, so want to save time for the answers and the discussion here today. So I will be sure to include, just starting off, some of the bios that we have. And if you have questions or resources that you can think of throughout the presentation, please feel free to upload them to the chat, and we'll make sure that folks across the board have access to those to the resources that you are sharing. So without further ado, I want to kick it off to Sean. Thanks, Sean.
Thanks, Ricky, and good evening, everyone. We are very happy that you're here, and we are so very happy to have our guest. As Ricky alluded, there will be, the bios will be included inside the chat, so you'll be able to see all the wonderful and incredible things our panelists have done But in order for us to have a full conversation, we just want to give an abbreviated introduction and allow them, as we have conversations, to talk more about their work then. So let's introduce our panelists in alphabetical order. Robert Arbuthnot, Chief of Staff for State Senator of the 14th District, Brian Williams. Dr. Alexander Garza, Chief Medical Officer of SSM Health and the Incident Commander for the St. Louis Metropolitan Pandemic Task Force. Marlon Marshall, Strategist and Grassroots Organizer and Founding Partner of 270 Strategies. Dr. L.J. Punch, Founder of Power for STL and a trauma surgeon, among other things. And so those are our guests. I want to thank you all for being here today. Just to kind of set the scene for our discussion or set the stage, in 2019, Washington University Center of Health Economics and Policy reported states who expanded Medicaid have 1, large reductions in coverage gaps, 2, improved access, and 3, no significant increase in statewide funding. Missouri ranks in the bottom third for many health indicators, despite Missouri being home to several large healthcare organizations, including the St. Louis market with $255 billion in purchasing power. Moreover, recent data has shown that the novel coronavirus has had a widely varied impact in different communities in the St. Louis region. While additional research is needed to highlight the causes of this varied impact, disparities have been experienced in communities such as Maplewood and DeVille, with similar population density and separated only by 7 miles. Additionally, many regional leaders and organizations have advocated for health equity solutions. They have centered social determinants of health as factors which influence adverse health outcomes, violence, and trauma experienced in many communities like St. Louis throughout the country. Medicaid expansion, Amendment 2 on the August ballot, is an opportunity to move in a direction towards equity. However, the upcoming state elections in the midst of a pandemic draws many concerns for voters, including voter safety at the polls, voter suppression, partisan politics, and much more. So there's a lot for us to talk about today, and a lot going on. And another aspect of the stage is the fact that, you know, we are all here virtually rather than in person. And so I know as we have been going through days of work or whatever, this has become the new normal, but we should never forget how abnormal all of this is and why we're having to meet in this way. So I want to start off our discussion kind of with somewhat of a simple question. Although we talk about health equity all the time, I don't know if there is a shared definition of that. So I want to start with Dr. Punch. I want to ask for them to talk a little bit about the definition. What is health equity exactly?
Those are words that can very easily get confused when we talk about equality and equity. And for me, if our hope is for everyone to achieve their optimal and best life and best health outcomes, equity is about giving people the support they need, meeting them where they are at, so that everyone has a road forward to that best outcome. And anything that falls short of people having access to that best case scenario is not equity. It adapts to need and the human on which it is focused, rather than measuring itself based on some absolute or standard that actually really doesn't exist. And so equality is actually pretty distant of a term from what equity really means. Okay.
Dr. Garza, would you mind talking a little bit about that? What is health equity from your perspective?
Yeah. So I'll just expand a little bit. So I think we have to be careful when we're talking about health equity versus equity in general. And the reason why I make that distinction is, so for instance, with Medicaid expansion, there would be more health equity because more people would have access to health care, would have those things available to them, primary care, all of those other things. And so in that instance, it would have more health equity. However, in order to achieve So that's mostly for the payment side, right? And for access.
Mhm.
But to achieve health, it's much larger than just expanding Medicaid. And so by that, I mean, it's clear that medical services really only contribute around 10, maybe 12% to a person's total health. And so even though we spend a little bit over $3 trillion a year as a country on healthcare, we really contribute a limited amount to the health of either an individual or a community. And so when we talk about equity, we have to think about equity as a whole. And so that means employment equity, that means education equity, that means having access to good foods and all of those other things that contribute to the health of a community and to the health of an individual. Medicaid is one piece, no doubt. We need to expand Medicaid and get better access to healthcare. So that is equity for the health delivery system. But we need to work on that long-term goal, which is equity across the board, which we know contributes to better health overall.
Okay. Marley, you have anything you want to add to that, or you want to chime in on?
Yeah, and I'm not, the doctors are ones who can definitely share the policy side and so much more goodness. I'll just give a personal story. My almost next month, actually September 1st, 3-year-old twin daughters were born at 29 weeks. And I was not there. I was out of town. The one day I went out of town is when my wife went into labor. And got back there about 2 hours after they were born. And I had 3 thoughts. Is my wife okay? She was. Are my newborns okay? They were early, but they were fine. They had a NICU experience. They were fine. And then, oh my God, they're gonna be in the hospital for a while. What's this gonna cost? And I went literally in that order. And so after I knew the health piece was okay, then I called the insurance company. My wife works at Planned Parenthood, and they have very great insurance. And luckily, it cost us nothing. And then I spent 2 months with many parents, some who could not be alongside their kids every day like we were, because they had to go back to work, because they had to pay for now what was a enormous bill for their kids for the fact that their kids were just born as early as our kids were. That's not equitable. And it just made me mad. And that we live in a society that allows that to happen, where someone has to choose between, do I go spend some time with my kid at the NICU so they can come home okay? Or do I need to figure out how to go back to work in order to have the resources we need for the situation? And that's not right. And so equity to me means no matter what we look like, we all should have access to the care and the health that will allow us to live our best lives and be our best selves. And unfortunately, that's not happening in the United States of America, and it's something that we need to change. And for me in Missouri, that starts right now with Medicaid expansion, which I'm working on. I can talk more about later, but there's a lot more to it as well, and I know we're going to continue that conversation.
So let me answer this question, and I ask this question, and I'll just kind of open it up to anybody who wants to jump in, because I don't want to put anybody on the spot this early. So why don't we have health equity? I mean, we've identified kind of what the problems are in a sense, and that we, in certain instances don't have it. Why don't we have health equity? What are the factors that contribute to us there not being an equitable system for everyone? I see smiles, I see knees. Go ahead, so I can start.
Politics. And
break it down.
Many people probably who are watching this right now, I'm gonna go back to Medicaid expansion in Missouri. Mm-hmm. There's a ballot initiative on Tuesday to expand Medicaid in Missouri. The reason there is a ballot initiative is because for 8-9 years, many folks who are probably watching this right now have gone to the legislature to say, can we expand Medicaid? Can we take advantage of the Affordable Care Act and bring our tax dollars home from Washington, D.C.? And time again, the answer to that was no, and that was because of politics. And so finally, a group of folks came together and said, we just need to go a different route and then go to the people instead of to the politicians who weren't making it happen. So I'm sure there's other reasons that other folks can talk about that, but the system changes because of politics. And what I'm hoping happens this year, but in many other years, is that those of us who know what equity should look like start running for these offices in order to change the system. And then we also pass ballot initiatives like Medicaid expansion on Tuesday.
I saw Dr. Punch smile at the question. You mind jumping in? You said no?
Well, I mean, y'all don't have enough time for that answer. But, there's two very big answers, and it plays off some of what Dr. Garza was saying earlier, which is that the components of what it is for all humans in the United States to achieve their best and fullest life are not in place, because they are not in place in the design and fabric of our country historically nor today, right? So white body supremacy makes sure that actually, no matter what color you are, people are different from one another, And so since we've decided to differentiate the value of one body from another, everybody, regardless of their color, in some way actually is experiencing that negatively in their body. So that is a big, I said, you don't have time for that. But the other thing I'd like to say, and I certainly see this in the world of trauma, is that health equity doesn't exist within health care, because the system doesn't just sort of neglect certain issues and certain groups of people, or just say, oh, shucks, you don't have insurance, too bad for you. The system actively benefits from making sure groups of people stay unwell. And you don't want to get me started on that when it comes to trauma, but it's a system that's not just designed for this, it thrives on it working that way. And until we can really start exposing that level of sickness within the healthcare system itself, I don't think we're going to be able to achieve equity for anyone.
Dr. Garza, you want to jump in there?
Yeah, just a couple of points. So agree with everything that's been said by Dr. Punch and by Marlon. For the Medicaid expansion, I think, Marlon, you worked on this up in DC when the ACA first expanded Medicaid. It took a lawsuit that went all the way to the Supreme Court that then stripped that provision out so it had to be opted in by the states. And it was it's more politically driven than anything. So if you look at Medicaid expansion, and you quoted some of those statistics across the board, it's a good thing to do, and it doesn't cost anymore. And so you have to then think about, well, so what is driving this? If it's all upside, then what's driving it is pure politics, right? We're not going to do what Obama wants, and so you can make your own judgments about that, why they wouldn't want to follow what Obama wants. And so that's absolutely true. The healthcare system in the United States is so fragmented and dysfunctional. It's mind-boggling, and I work in it, and I'm still confused a lot by it. If you look at all the other organized industrial countries that have much more nationalistic social health systems, their outcomes outpace us by a mile, and they're cheaper. And that's because, to borrow your term, it's equitable. Everybody has access to healthcare. There is no worrying about how you're going to pay your health bill. Because it's distributed amongst the population. Now there's different variations of it. If you go to Germany, there's a plan for everybody. You can also purchase, additional insurance and things like that. But in no other industrialized country are you exposed to the whims of the market, which is the insurance market, and are you penalized for not having a job that offers private employer insurance, or if you fall through a donut hole, or all of these other things. And part of it is, embarrassingly enough, was instituted by the medical societies. If you read back in the history of how healthcare was started in the United States, and it was based on greed, to be honest. And so I guess the point I'm trying to make is it has been institutionalized across many different sectors in American society. And so that has formed a lot of scar tissue. And so in order to break it all down, and you know, I applaud the Obama administration for taking the first step with the Affordable Care Act, because he knew he was never going to make, you know, it all the way to health care for all, not with the Congress divided. So it was a first step. But my point is there's a lot of institutional inertia against fixing the system.
And so we keep saying kind of politics. And so, so can we, is anyone comfortable, and maybe I'll ask Marlon this and go to Robert, are we comfortable talking about what that exactly means in terms of politics? How is it that politics works to help establish a system that we see to be so unequitable?
Yeah, I mean, it starts with the people who represent us. And the system that we have been built on that, you know, I'm glad Dr. Punch started with this, so I'm gonna keep running with it, that is built on white supremacy. And we don't, like, I don't think now maybe we're realizing that that's the kind of system and culture that we live in, but I think for a while we just were in it, and so it's hard to see what you're in until incidents happen that have happened in recent months, with George Floyd as an example. So when you have people who represent us, one, participate in that system, and then two, like to Dr. Garza's point, the whole reason the Affordable Care Act and the Medicaid expansion provision went to the Supreme Court wasn't because of outcomes for a healthy society. It was because of politics. It was because there was a party who didn't like it. They wanted to use it as a way to try to defeat President Obama. There was other, in my opinion, racial reasons. And that's why I went all the way up to that place. And so it starts with who represents us, who is going in, and, you know, we hear about the policy, as Americans, we hear about policy at a very high level. There's so many laws that are embedded in, you know, federal laws, state laws, local laws that are just that are rooted in the supremacist culture. I encourage everyone to read this book by, his last name's in my mind now, but it's called The Color of Law, that talks about all these, how this was created. And so until we get folks in and vote for them because of policy, and Missouri actually is a fantastic example where you have people who run for office who are like, I'm gonna raise the minimum wage, I'm gonna support Medicaid expansion, et cetera. They lose. But when you run the policy as a ballot initiative, minimum wage was expanded in Missouri. I'm hoping next week Medicaid expansion wins. And so when you take this to bare bones policy, people are like, yeah, I want more healthcare, sure, right? So we need people who are elected where we can start to break down that culture. And this is a long-term project for our country. This is something that I know I want to fight on until I'm no longer with us. But that's where we have to go. We have to change the face of what the people who represent us look like, and be more than just what we're hearing at this high level, and understand really what they're going to go in there and try to do.
So Robert, you're kind of closer to the ground. A lot of people don't think about state government very often, or often enough sometimes, because as Marlon just talked about, we get a lot of attention about what goes on at the federal level, but you're at the state level. What are some of the things that you're seeing that kind of, that you observe as the chief of staff there in the Senate and in the General Assembly, that kind of show some of the political problems that interfere with people being able to have equitable access to healthcare?
Thanks, Sean. And I want to go back to what Marlon was saying. I agree with him 100%. We have to vote for candidates that share our beliefs and our values. We saw medical marijuana passed in Missouri. We saw right to work defeated. We have a great chance to have Medicaid expansion next week, but we have Republicans have a supermajority in both chambers and control of the governor's office. So I think about this last session where my understanding is that Missouri is the only state in the country that does not have a statewide prescription drug monitoring program. So I watched one Republican senator on the last day of session obstruct prescription drug monitoring, and it was defeated because of one Republican senator. We were right there at the doorstep, and his frustration with not getting what he wanted in a crime bill led him to obstruct PDMP. So here we are, still the only state in the country without PDMP. We have to understand the issues and then vote for the candidates that share our interests.
Indeed. So let's move a little bit more up the spectrum. We talked about health equality or equity and what that means. There's another term that gets bandied about a lot, and I like for you all to talk a little bit about it, but I want to talk about it from two perspectives. We talk about determinants of health, and generally determinants of, we talk about social determinants of health. And so, Dr. Garza, could you give us a definition of what social determinants of health is and how that impacts health equity and impacts individuals?
Sure, be happy to. So let me describe what the classic definition of social determinants of health, and then I'll expand a little bit about how I've come to think of this more here recently. So the social determinants of health are all those things outside of healthcare that can impact the health of an individual. And so it can be anything from the environment that you live in, to access to good foods, to the education system, to the family dynamics, and on and on and on. Now we know that the way I describe healthcare is we're more into defect management than we are into really promoting health. Yeah, we want everybody to be healthy, but frankly, if nobody had a heart attack, a cardiologist would be out of business, right? And so why do people have heart attacks? Well, they smoke, they have high blood pressure, they eat poorly. All of these things contribute to heart disease. So why do people have these exposures? Well, people live in a poor environment and they don't have access to good foods. They aren't educated, all of these other things. So why is that? So you have to keep asking those whys until you get to the root of what the problem is, which then goes back to your equity question, right? So you have to work on those root causes in order to improve health, which is why it drives me crazy that the government and a lot of people believe that healthcare is the sole determinant of how healthy a community is, and I think that's the wrong way to think about it. So as I get to thinking about social determinants of health, and that's a very popular term to use, I think we need to start shifting that into, we should start calling them political determinants of health, because it's not really society, well, maybe it is society that's dictating these determinants, but it's also heavily, if not exclusively, influenced by politics as well. And so I think that's a fair descriptor of how we create these conditions that drive towards poor health. And a lot of those are political decisions. So that was a really long-winded answer to your simple question, and I apologize.
No, you don't. That was great. And you anticipated my direction because I wanted to talk about political determinants of health. Mm-hmm. So I'm glad you mentioned that. Dr. Punch, with your work at the T and Stop the Bleed, can you talk a little bit about, from the perspective of the patients that you advocate for and that you help heal, kind of what are the impacts of those social determinants that we just talked about? How does it impact them?
I have been learning a new framework for thinking about health and the seeming tension there is sometimes when someone has forces around them that are acting against their ability to be healthy, and yet they continue to be in a situation where they have to make they feel they have to make the choice that harms them. So, for instance, violence, right? Violence, it seems like such a self-destructive, unvaluable action or behavior pattern in a human being. So why would we do it? Why would people so frequently become involved in it? And why would it be existing at, forgive me, public health people, but I'm going to say epidemic levels in our region? Why? And it's because of this. This is a fascinating concept I've learned from the Full Frame Initiative. And it says that actually people do what they do to protect their well-being. And well-being is different from health. Well-being is having what you need so you can eat, having, feeling like you have meaningful work, feeling that you're safe, feeling that you're connected to a greater purpose, feeling that you have people who are close to you. Those determinants push our behavior more than health. Health is a byproduct of our environment, not a human choice.
Mm-hmm.
And so what I see is when it comes to the issues I see in people, not only do they not have what they need environmentally to be healthy,
Mm-hmm.
they not only have forces that are causing them to choose things that very much threaten their health, but they are literally having to make choices between factors that many, many people couldn't begin to imagine just to survive. And so for me, the discourse is about social determinants of health, but it's also about social determinants of well-being, because so much of what I see in the lives of my patients is this sort of very complicated mix between the environments they're in and the choices they seem to be making. And a lot of what I want to help people see and know and learn how to do is to gain power, agency within those environments and act differently. Now, this is not trying to mind meld and create resilience and empower people. No, 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 no. I'm talking about bringing awareness to people so that they understand the ways in which the environment they're in and the forces that be are causing them to make choices that aren't going to get them where they want to be, and to help people think about a different path while at the same time trying to work on those forces. So that was another long answer, but I just can't, I can't do the work without thinking a little bit about the forces, not just of health, but the forces that create well-being, and the way those two need to meld inside an individual person for them to experience, again, that best life that I was mentioning earlier.
So
I will be the first donor to Dr. Punch's gubernatorial race. I hope everybody joins me.
I mean, when you talk about, both you and Dr. Garza talked about forces, we oftentimes, when I've heard the term social determinants of health, it's almost an added responsibility placed upon the individual without recognizing systems. And it sounds like what we're talking about here is that there are a variety of different systems that impact individuals and impact the range of choices that they have. And that if you don't deal with those systems, then it's very difficult to address the various needs that a person has, because they'll always end up right back into that system or that confluence of systems that impact them. So Marlon, we talked a little bit about, we've talked a little bit about social determinants of health, and someone talked about, I think several people mentioned the color of money and that, or the color of law, which talks about redlining and how that was kind of a systematic plan across several administrations that resulted in communities being formed and segregated the way that they are, and how that has had an impact today. And that seems to kind of go really smoothly into political determinants of health. Now, there's a book by that name. I haven't gotten all the way through it, but it's very good. I think someone has put in the, so far it is, I think someone in the chat put in a link to the book. It's by Daniel Dawes. And he outlines 3 different things that are aspects of political determinants of health. Voting, the people that we vote in, and their ability and their savvy to be able to affect things in the system that they've been elected to as representatives. Government, which is kind of the apparatus of those kinds of decisions. And then lastly, policy, which kind of codifies all the different choices that are made by voters and government. So when we talk about political determinants of health, we talked about this a little bit before. I'd like for you to kind of talk from a national perspective, and then Robert, we can talk a little bit from the state perspective. What has been those political determinants of health that's resulted in this system that we talk about? What are those political determinants that have impacted people in such ways that we've talked about?
Yeah, it's a great question. I think I agree with those 3. I do think it's voting, government, and then the subsequent policy that comes before it or that comes after it. I do think it's important that we acknowledge the history of all of that, right? So you mentioned redlining, like those 3 things were involved in that being something that happened, right? And obviously because of racism and whatnot. And so I just think the culture that has also led to where we are must be acknowledged also. So it can't just be like, I'm gonna go out and vote and we're gonna get new government and we're gonna get new policy. If we don't talk about the supremacist culture that has existed for 2 centuries in this country, then for longer really, then we won't understand that like we can get the best people in, we can do all this, we can do all that, but if there's no acknowledgement of like that larger why, we won't fix those political determinants of health. So
can you break down that why? Can you break down that why a little bit? What you just said we need to discuss. Break that down a little bit more. What are some of the aspects of the why that you think people really need to understand?
Well, the United States was built on, and the governmental system is built on racism, institutional structural racism. That is, and it still exists to this day. And unless we just say that and look at that and acknowledge that, and acknowledge, like, again, using the color law as example, understand like, oh, this is how this got to be, then we're not gonna fix it because we don't look at the root of the problem. We just say, we gotta get more people to vote. We gotta, but like, we have to expose and discuss how we got here, so then we can start getting the people who will run for office to be in a different mindset, who will then be in government to make the policy different, right? And that's why I think it's gonna be a longer process than just like snapping our fingers, but it is, that system was built. And so you've had people of all races who have been in the system that just, you all of a sudden get in there and then you're just part of the system. And so unless you're talking about the system that you're trying to get in and actually break and make new and whole, then you're not going to be able to fix the system. You're just going to go in and you're going to be part of the system. And then I think, and to me, part of that is like, I'm very passionate about education. My mom was a teacher at Bryan Hill Elementary in downtown St. Louis for 35 years. And I don't think we as a society properly educate all of us on our civic history and civic engagement in the United States of America. And ending, I think the other, like to your point about the national level, like we get so focused on who's the president, which is important, don't get me wrong. And don't ever talk about like, who's my mayor or who's my board of aldermen, that is also making a very direct impact on your life, right? Because we are just all CNN, Fox News, all that stuff all day by day by day. And part of that to me is a lack of the civic education and that we have in this country, which is why our civil discourse has gone so many different ways. So I think we have to acknowledge our history, like our real history that some people don't ever want to talk about, but like, you know, it's starting to open up. We just need to really get into it. And then we need to really start to educate the next generation on that history and on why participating and who we need to like, why participating is so important. And we just don't do it. Like I think about what I learned about as a young Black kid, what I learned about, history of slavery. It was like, there was slavery and then MLK and Rosa Parks fought for you. And then there was Obama, right? Like, and that's not at all obviously how it is. And we need to start having some real conversations with us as adults, and then really start to educate the youth on America and how we got here and how we fix it.
Robert,
I'm sorry.
Robert, I know that at the state level, talking about racism can be very fraught and things of that nature. But is there anything you want to add about kind of at the state level, some of those political determinants of health that are impacting communities and how people perhaps should be more involved, piggybacking on what Marlon was saying?
Yeah, one thing that I wanted to add was in 2018, there was a ballot initiative, better known as Clean Missouri. And a lot of the talk was about ethics reform, lobbyist gifts and things of that nature. But I think one of the most important components of that was the redistricting. And when that passed, it's going to change the system of how the boundaries of the districts are drawn throughout the state. So you'll also notice that on the upcoming election, that Amendment 3 is going to talk about this same issue. So it's being packaged as ethics reform, taking that even further, but is solely about redistricting, because the way the districts are drawn currently has created an environment that has produced a supermajority for Republican control. And so they have, like I said before, control of both chambers and the governor's office, so they can do whatever they want to do. And I'm pretty sure they'd like to keep it that way. So if the new system is going to create a system where districts are more competitive and you can have diverse representation, that could be a political game changer. So we have to pay attention to those details, and the word I guess we would use is gerrymandering. And you're gonna have, a political food fight about that term, but redistricting is a large part of the political landscape of Missouri, and we have an opportunity to address that now.
I want to move quickly, especially while we have Dr. Garza here. Since we're talking about disparities and social determinants of health, we've seen a disproportionate impact in the Black community related to the pandemic and COVID. And we've also seen recently very bad news from across the state in terms of community spread and increase in infections, even as we open up the state again. Dr. Garza, if you could give us a little bit of a quick little update about what's going on, and then talk a little bit about the disparate impact of COVID in Black communities.
Sure, be happy to, Sean. So I think, as everybody knows, cases continue to go up in St. Louis, in the St. Louis metropolitan area, as well as across the state. And so, previously in the pandemic, it was really isolated to the more urban areas, but now it's fairly widespread. So it's in the suburban and rural areas across the state as well. And so, and that's really because of some flawed policy, I think. But in answer to your question about how it disproportionately affects different communities, particularly the Black community, and I've given these statistics out in some of our press briefings, where even though African Americans make up about 18% of the population in the St. Louis metropolitan area, but yet the burden of COVID, as far as mortality is concerned, is nearly, about twice as much compared to non-Blacks. So more likely to be diagnosed positive with COVID, about 4 times more likely, about 2 times more likely to be admitted to the hospital, and about 1.5 times more likely to be admitted to the intensive care unit. Now, when you look at mortality, the mortality doesn't change between Black and non-Black, but really that's because of care that's delivered inside the hospital. But if you look at it from a numbers perspective, the rate of mortality for the Black population is much higher than the white. So even though the mortality of surviving once you're in the hospital is the same. There's more Black people being admitted to the hospital on a whole. And so when you look at it from a population statistic, it impacts the Black community much more. And so there's probably a couple of reasons for that. So one is just what we spoke about here earlier, a lot of chronic disease in the Black community because of those social determinants of health. But there's also other reasons that aren't talked about as much either, and that is a lot of people in the Black community are essential workers, and so they take public transportation, which increases your risk of exposure. They do a lot of service industry jobs, which means they're at risk of being exposed to somebody at their job. They have to travel long distances to go to work, things like that. So they don't have the capability to shelter in place as other more affluent areas of the city are able to do. And so there's multiple different factors that play into the incredible burden that the Black community has with COVID.
And I really want to hone in on that and also give Dr. Punch an opportunity to kind of weigh in too, because very often when we talk about these issues, it's almost, and I really appreciate the way you talked about it, Dr. Garza, it's almost a blaming of the Black community, as if they did not have all these problems, then they wouldn't be as vulnerable. Mm-hmm. When again, as we've been talking about already, there are systems that at play. Correct. That are impacting people's freedom and ability to be able to have access to the things that they need in order to be healthy. And so there was a report that was put out with, I know RHC and IHN and various other partners put together that talked about those disparities, and it kind of compared the Ville, which is a historic Black community, and Maplewood, and showed the disparities there. In terms of how many people are infected per 100,000. And it's a startling thing, but just off the top of my head, when I think about Maplewood has several supermarkets. And there are access to various things that are not available there at the Ville. Right. So Dr. Punch, can you talk a little bit more about that in terms of the impacts of COVID and why it is that Black people are enduring such a burden related to the pandemic?
So I would start just by challenging the word disparity, because it assumes an equal starting point, a similar starting point, as if there's just purple people over here and yellow people over here and red people over here and rainbow people over here, and there's disparate outcomes. Because that language is exactly how the identity takes on the burden of the variation. When the truth is, it's more like marbles in a marble machine. You go this way, you get this. 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 There's nothing shocking about any of it. It's exactly what we'd expect. And so how did we know coronavirus was going to act the way it was going to act in our city, and draw a line as deep and as gouged into our city as Del Mar is, the same way so many other things play out? Because the truth is, we're not all playing the same game, okay? And so I said, I think I recorded this video, I don't know if it was in March, it might have even been in February, when I talked about the virus, knowing that the virus was going to have a pattern very, very similar to the pattern of gun violence. Knowing it was going to have a pattern similar to the pattern of opiate overdose. Knowing it was going to have a pattern very similar to the pattern of homelessness, because it is a vector. It is a vector for injury, which takes advantage of the host environment. And if that environment includes stress, if that environment includes an inability to control where you sleep and eat, if that environment includes an inability to change the way your work, family, social life happens, you're going to be more vulnerable. There was an incredible professor at SLU, Norm Smith, correct? I always want to call him Norm White, God bless his soul.
No, it's Norm
but,
White.
Norm White, sorry, Norm White.
Mhm.
It was Norm White, God bless him, who talked about the concept of inescapable risk. That people share a collective experience based on the combined risk of everyone in their neighborhoods, and that children express risk in a very, very powerful way, but it is an inescapable risk. And he talked about that a lot in terms of the school to prison pipeline, but the same is true for bullets, opiates, coronavirus, and homelessness. And I think we have got to stop using identity to describe the disparity, because then again, it just makes it too easy to say Black folks are having this outcome, and that's far away. And it's just too bad. And I wish somebody would help them.
Okay.
Instead, we can talk about humanity and say, we are okay with a life and a system and a line cutting right through our city that allows humans to have wildly different experiences, and then explain to ourselves why that's okay. And then we can start doing the work and bringing equity.
We've got a few questions in the Q&A that I want us to get to. We're rapidly running out of time. It's been a fascinating discussion and hard to keep to time. So let's get to some of these questions. I think that there's a question that Dr. Garza hinted at the answer to, but this particular person, Brandon Pittman, would like for the rest of the panelists to touch on the privilege of social distancing as it relates to minority communities who may not have the ability to do so. I'm going to pitch that to Marlon and see if what are you thinking about that?
Yeah, and also if you don't mind, I saw Brandon's other question, so maybe we'll try to touch on that too, about
Please.
How do we use how can we advocates put pressure on those at the state and federal level? You know, I think there's been a lot of shocking things in the past few weeks in terms of the unrest in this country and the protests that are happening. One of the most shocking to me is Mississippi in a heartbeat removing the Confederate flag. And the reason that started was because an athlete for university was like, F y'all, until you change this flag, you're not gonna make more money off me. And then they were like, whoa, right? And so I think something that's very powerful, obviously, in our society is money. And, you know, if you've seen like Facebook, for example, there's been a huge campaign to get advertisers to pull money out of Facebook until they address the hate speech that happens on their platform. And I think as we as advocates, how do we look at part of the reason the system is the way it is that we talked about at the very, very beginning, the health system that is designed this way, is because it's financially beneficial to have the I don't even want to say disparities anymore, but it's financially beneficial to have that. And so we need to start targeting folks' money and use our voices to really have them understand how to make the change that we need to do. So that's point number one.
Quickly.
The second question, I'm going to that. Oh yeah, privilege. I think, you know, it's maddening that you just knew when this virus came here what was going to happen. I think Dr. Punch just said that, and it goes back to the, you know, what I experienced again in the NICU is like folks have like the way the system is set up. You got to go back to work, and so yeah, there's not the social distancing is a privilege where you're like, well, I got to work, and my work doesn't allow for social distancing, and like in some cases, works don't even require masks, and they're not there to protect you, and so we have to, as humans, like come together. The one thing about the political determinants of health, I've been really big recently on like, all right, I can't just in my lane focus on, again, right now I'm focused on expanding Medicaid, but after that's over, and hopefully we win, like, and we work on implementation, we gotta get everyone at the table for this implementation conversation. It can't just be the hospitals and a couple other groups. We need to get civil rights groups. We need to get, like, we have to like start building these coalitions and stop thinking in our silo way of like, I care about this issue, because everything is all interconnected. And until we start fighting these fights in an interconnected way, then it's going to be really hard to move things forward. So I
Ron,
agree. There is a lot of privilege in that. Yeah, sorry.
that's all right. I want to get to another question that was asked by Tess Jewel, and they ask, or they're saying, I would love this group's perspective on how we as healthcare leaders can influence and bring about meaningful change within the systems that we work that are contributing to these inequities. So who would like to take that? To say again, I would love this group's perspective on how we as healthcare leaders can influence and bring about meaningful change within these systems. Dr. Garza, you want to take a stab at that?
Yeah, I'll give some comments, and this is something that we've been thinking about, and I mentioned a little bit about this early on, where healthcare systems are really in the defect management system, and that's what we get paid for. We get paid when you have to do surgery. I think Dr. Punch was alluding to this. You get paid when you have to put a stent in an artery. But so we're good at the tactical work of fixing defects, but really the essence of healthcare, the essence of a healthcare worker should be to put themselves out of business. And what do I mean by that? That should be, we shouldn't have the heart attack in the first place, right? So if we truly care about the health of the individual, then we need to be going further upstream. And by going further upstream means not just tackling, not just putting a clinic in a neighborhood. That's still defect management, so to speak. There's primary care. I don't want to disparage the primary care because we certainly all need that. But we have to be working on the things that create the conditions that lead to poor health outcomes. And so I believe healthcare should be moving further in that direction. And some systems are moving in those directions by making direct investments into the community, not just from a healthcare perspective, but from an economic perspective, from an education perspective, from looking at it in a different way. There's a good program up in Chicago that's doing a lot of good work on this. So it's recognizing that we need to be community partners, and to be a good community partner isn't just about delivering healthcare. It's about trying to fix the underlying issues, the social issues that contribute to poor health.
We are at 8 o'clock, and I do really want to give Dr. Punch an opportunity to weigh in on this if they would like, but I want to check time. And so how are we doing on time? It is 8 o'clock. Do we want to move to kind of wrap up, or do we want to spend 5 more minutes talking? Somebody give me some.
Well, I would love to hear Dr. Punch's thoughts.
Well, I mean, I put in the chat, defund the hospital. So what do I mean, right? I mean the same thing my friends mean when you say it about something else, which is, why have we as a system allowed the public to believe that we are the answer to what they ask us for? This is why I have such an immense focus on community health education, because people aren't learning the most basic things about their bodies anymore. People don't know the power they have to influence their health, and people therefore can't stand in a posture of mutual aid to advocate communally for what they need to be well. We allow people to come to the emergency room with a tummy ache and create a bill that makes it so everybody can go and sleep in the bed at night, but that person is no better off when they leave that ER than when they came. We allow that to happen. We are okay with the system working that way. So I think one of the same way law enforcement is really having a hard time with defund the police, I think we should hear those words and think about the ways in which we're like, wait, our hospitals would close. Oh, wait, we wouldn't have enough nurses. Well, why? Maybe if we upstream, you hear me? If we took the step, the same thing we're asking law enforcement to do right now as a country, then maybe we would actually begin to see the outcomes we're all dreaming of. Because we all got into this thing because we just want people to be healthy and happy.
Mm-hmm. And it seems as if the system ends up making people sick rather than healing people. So Ingrid Taylor asked, how do you ensure that if Missouri expands Medicaid, that it will provide enough health providers to see these patients in a timely fashion and provide the high quality of care that fits each patient's need? Don't know if someone wants to tackle that at all. That's probably going to be a very big issue. That kind of gets us a little bit into the weeds, but I think one thing to keep in mind about Medicaid expansion, and I think this is probably appropriate for the full group here that's listening to the conversation, is that we need to have you, whether you're within the healthcare system or not, be engaged as advocates, because expansion wherever you are, but especially in Missouri, is only a step. If we expand Medicaid, we don't do anything after that, we don't stay engaged, then the system will not change. This just brings more resources in so that it has the opportunity to reach more people who don't have access right now. We've got to stay engaged. I'm looking at more questions here. So an anonymous attendee asks, how do we challenge the idea of still having to make the case to provide resources and take action when we have a pretty clear idea on how communities of color will be impacted from the start? How much more data do we need to see? Marlene, you want to tackle that? Then Robert, let you.
Yeah, I think we just start calling people out. Yeah, I don't have I don't think we need to see any more data. Again, Dr. Punch said it. When the coronavirus came, we knew what was going to happen. And I said to my wife, I was like, the minute the numbers started going in the direction it did, I was like, watch, this is going to be forgotten about. We're going to let's reopen. Everything's fine. It's going to be okay. I think we are in an era where we have to be loud, and we have to make sure our voices are heard, and we have to be real and not sugarcoat anything. I almost said expletives, but I'm not. But we just again, I'm using the example from Mississippi. We got to target the pocketbook, and we just got to be, people don't want to be called something out of turn, and we have to hold people accountable for what's right and what's just, and we have to be loud. And that's why these protests are still going, and we have to keep going. We have to take that energy all the way into November, and forget party. I'm not even talking about party. Let's just elect people who will go in and do right by us. We are electing them. So I don't think we need more data. I think we just need to start being loud. I think we need to start calling people out. And I think that's starting to happen. I hope that continues, and we can't let momentum die when the cable news networks go on to some different story. We still got to just continue loud and vocal.
Robert, I really like your take on this, because in Missouri, there's a lot of data that floats around, but how effective has the data been in changing minds or affecting people at the Capitol there?
The data is one thing, but I think voting is the most important way to influence people, elected officials particularly. Marlon mentioned a very important election coming up in November, but however, there is a primary election next week that is critical, particularly in St. Louis County and the city as well. So when you participate in these local elections and primary elections, that has a direct impact on your everyday life. For example, Wesley Bell was elected prosecutor in St. Louis County. That was a monumental shift, and how the same for Kim Gardner in St. Louis City. So when you participate in local elections, that is how you see a more immediate change. And then, for example, I'll go back to medical marijuana. You see that being implemented at the state level throughout the country, and that will then funnel up to, you might see a shift at the federal level. So to affect more immediate change, we need to get active in primary voting and local elections, and taking the energy from the protest to the polls. I think that's a good way to get results.
Great. So we are at 8:07 at this point. So I want to give each panelist an opportunity to kind of give like a little closing statement. What is it about that we talked about today during our conversation? Some point that you really want to leave our attendees with as we segue to Mike talking a little bit more about Medicaid expansion. I'll start with Marlon, and then I'll go around. So Marlon, what's one point about you want to leave with everybody so they will be more engaged?
Don't be quiet. Talk about how we got to this point and be real about that, and do whatever it is for you to take action moving forward. And I would say action every day. It doesn't mean you got to be making phone calls every day, but something where you feel like we are slowly breaking down this system that holds people back every single day. And Dr. Punch said my favorite word that I like literally say to myself every day, but it's awareness. So often we don't have awareness, and just be aware every day. And that's the first step in changing this world, not even just the country, this world. Thanks for having me.
Dr. Punch?
One thing, you are loved. That's it. Remember that. The rest is details.
Robert?
I would say I would leave with everyone to get involved. Go to attend the Board of Aldermen meeting, attend the county council meeting, educate yourself on the issues that are important to you, and then exercise your right to vote.
And Dr. Garza?
Yeah, I mean, I'll just make a couple of points. So one is that, health is an outcome of many things. It's not, it doesn't exist in a silo. And so, I think it's related to everything that the panel was talking about tonight, whether it's racism, economic policy, many things contribute to health outcomes. And so you have to understand that, and you have to think broader on how can you improve not just health, but how do you improve society? You improve society, health will come along, but it can't be the other way around.
Right. Well, thank you again for all of our panelists for participating, making, and giving us a lively conversation, very informative, really enjoyed the time together. Thank you so very much. And I'm going to give it over to Michael to talk more about Medicaid expansion.
Sean, you set me up for failure. How do I follow that amazing panel? Thank you all so much. Thank you for being an amazing moderator. We can't give applause, but if we can get everyone in the comments just some thank yous, some exclamation marks to just show our panelists so much love. They even went 10 minutes over for us, and they're incredibly busy, especially during this time. So thank you, thank you, thank you. I've been so excited this entire conversation, learned so much myself. So we appreciate you. We might have to get you back on in October before the November election. We might have to figure out a part 2 to get you all back on. This has been absolutely amazing. And I'm just getting text messages. I'm getting DMs, comments. And so thank you all for the incredible wisdom, the incredible knowledge. As mentioned, Yes on 2 is on the ballot August 4th. It is the single most reason to get out to vote for every reason that was expressed today. Not only do I have the opportunity of serving as the president-elect of the NAHSE St. Louis chapter, but I also have the privilege of serving as the coalition's director for the campaign. And I can truly say that the coalition is a representation of how monumental this issue is. You have the Archdiocese, you have Missouri Chambers of Commerce and Industry in agreement and alignment with the NAACP, the Urban League, so many other community and grassroots organizations, multiple faith groups. The spectrum is wide, and so we want to be sure that we can get this passed so we can take a step in the right direction to disrupt dismantle these systems and continue this into the November election as well. And so again, thank you all for being incredible guests. Thank you all for being incredible panelists. We thank you so much. Everyone have a wonderful night. Be safe. And as Dr. Punch said, we love you.